Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
All right, today we're talking about a medical tool that has a pretty fascinating double life, the nerve block. Now, on one hand, it's a really critical weapon in the fight against chronic pain. But on the other, it's right at the forefront of a revolution in surgery, pushing into the wild world of AI and robotics. So let's explore how this one single procedure is shaping two very, very different futures of medicine. You know, to really get the story of the nerve block, we have to start with its oldest enemy, pain. It's something we all experience, of course, but when it becomes chronic, well, it turns into one of the biggest challenges in all of modern medicine.
And this is not a small problem. We're talking about millions and millions of people whose lives are just fundamentally limited by musculoskeletal pain. This image, it's from a campaign by the Global Year Against Musculoskeletal Pain, and it just captures that feeling perfectly, doesn't it? It's a condition that can feel like it's literally crushing you, affecting everything from your job to just moving around day to day.
So what happens when things like physical therapy and medication just aren't cutting it? Well, patients and doctors are faced with a really tough choice. The next step often involves more invasive treatments, and that right there, that's where our story really begins.
Okay, so what is this tool that kind of stands in the gap between conservative care and major surgery? Let's break down what a nerve block actually is.
At its heart, it's a beautifully simple idea. I mean, think about it. If a specific nerve is sending pain signals up to the brain, a doctor can inject a local anesthetic right next to it. It's like hitting a temporary mute button on that nerve. The pain signals get interrupted and boom, the patient feels relief.
And here's where it gets really clever. Before you can treat the pain, you've got to find it, right? A nerve block can act like a diagnostic tool. It's like an electrician trying to figure out a flickering light. You switch off one circuit, and if the light stops flickering, well, you found your problem. It's the same idea here. Numb a specific nerve, and if the pain disappears, you've found the culprit. So this is the crucial point to remember. Nerve blocks are playing two different games. First, they're a diagnostic tool, like a detective, to pinpoint the source of pain. And second, they're a therapeutic tool to actually treat it, giving people hours or sometimes even months of relief.
But this is where the story gets a little more complicated. You'd think a tool this precise would be a magic bullet for all kinds of pain, right? Well, the evidence tells a more nuanced story. So let's look at the tale of two very different pains, chronic pain versus surgical pain.
Listen to this. This is a direct quote from the International Association for the Study of Pain, or IASP, and it's really telling. They're pointing out that for some of the most common procedures, like steroid injections for joint pain, their widespread use doesn't really match up with the high-quality evidence. A bit of a disconnect there.
And this table really lays it all out. For certain conditions, like pain from the little facet joints in your spine, a procedure called radiofrequency denervation shows pretty good results. But, and this is a big but, the relief is temporary. We're talking 9 to 10 months on average. For others, like epidural steroid injections, the effect is modest and it doesn't last long. It really highlights a tough reality in managing chronic pain. What works is often super specific and it's rarely permanent.
So this brings up a huge question. If nerve blocks aren't always the slam-dunk answer for chronic pain, where have they become a true game changer?
Well, the answer isn't in treating pain that's been there for years. It's actually in preventing pain before it even starts. The real breakthrough is in the operating room, and it's all thanks to a revolution in how we can see inside the human body.
The key technology here is ultrasound. With an ultrasound machine, an anesthesiologist can see the nerve, the tissue around it, and the tip of the needle, all in real time. This completely transformed the procedure. It went from being based on just anatomical landmarks, kind of like navigating with an old map, to one of incredible precision. They can guide that needle exactly where it needs to go, bathing the nerve in anesthetic.
And the benefits here are just massive. Patients can often avoid general anesthesia entirely, along with all its side effects like nausea. They need way fewer opioids for pain control after the surgery. And because they're in less pain, they can get up, start physical therapy, and just recover faster. It's a huge win all around.
And think about this for a second. The surgery itself might only take an hour, but the nerve block keeps working for up to 24 hours. That provides this amazing bridge of powerful pain relief that covers that critical and often most painful initial recovery period.
Okay, so ultrasound made nerve blocks incredibly precise. But
What if we could make them even more precise? What if we could take human variation out of the equation almost entirely? This is where the story takes a sharp turn towards science fiction.
Right now, the biggest bottleneck is just human skill. Becoming an expert in ultrasound-guided anesthesia takes years of practice. It's this delicate, three-dimensional task that requires immense hand-eye coordination. So how do you scale that kind of expertise? How do you make it available everywhere?
Well, the answer might be you teach a machine. Just look at this comparison. On the left, you've got a standard ultrasound image, and to an untrained eye, it's just a mess of gray shapes, right? But on the right, an AI has instantly analyzed that same image and perfectly identified the cluster of nerves. See that bunch of grapes pattern? That's exactly what anesthesiologists are trained to look for.
And it gets better. The AI doesn't just see the target, it actually plots the course. In this image, the AI has marked the target nerve areas in green and then calculated the absolute optimal path for the needle, that dashed line, to reach them safely and effectively.
So what you're seeing here is basically the roadmap to a future of autonomous anesthesia. Step 1, an AI identifies the anatomy. Step 2, a robotic system calculates and executes the perfect path. Step 3, the system guides the needle. And Step 4, the anesthetic is delivered with a level of precision that could one day surpass even the most experienced human hands. This could mean more safety and better access for patients everywhere.
So we've gone from a simple injection to quiet a painful nerve all the way to an AI-guided robot performing one of medicine's most delicate tasks. The evolution of the nerve block is just staggering. And it leaves us with a final thought to chew on. As technology like this continues to get better and better, what is the doctor of the future really going to look like?